Health officials are raising the alarms about post-Thanksgiving surges in the coronavirus. Any spike in cases related to the holiday will come as COVID numbers were already surging to record highs across the U.S. And joining us to discuss the latest COVID-19 updates is Quick Takes Madison Mills. Madison, we know people traveled for Thanksgiving despite the recommendations of health officials. How could this possibly affect the COVID numbers in the U.S.? And when will we know of that extent?
Right, Renita, that is the big question here. But just to take a step back, it was already a very dire picture around the country with about one death every minute over the past week, which is a huge spike in these COVID cases and deaths, right? This means hospital beds were filling up across the country, which not only impacts COVID patients, but also impacts anyone coming in for an emergency procedure of any kind. So all of that is to say that this was already the scene nationally before we had Thanksgiving, right? And we know that over 6 million people were flying in the days leading up to the holiday, despite the CDC guidelines that you just mentioned, Renita. But I want to play a quick clip from Dr. Fauci about how this uptick in travel could potentially impact these COVID cases. So let's take a listen.
What we expect, unfortunately, as we go for the next couple of weeks into December, that we might see a surge superimposed upon that surge that we're already in. And when I give that message, I don't want to frighten people, except to say it is not too late at all for us to do something about this, because as we travel back, to be careful when we go back to where we are, to just continue to do the things that we've been talking about.
And Fauci's warning, Renita, really mirrors that of other health officials, right? We heard Dr. Deborah Birx this weekend saying that if you traveled for the holiday, you should basically assume that you've been exposed and get tested this week, which brings us to the question of when we're going to know how bad the impact of Thanksgiving is going to be. The incubation period for the virus is 2 to 14 days, but most people who get sick develop symptoms about 5 to 6 days after that initial exposure. So the end of this week is when we'll start to get a clearer picture on just how big of an impact Thanksgiving travel is going to have on these rising COVID numbers.
So that's when we'll get the picture on rising COVID numbers. But there's also hopeful news coming out around vaccines. Now, what's the latest on the effort to get these vaccines approved?
Right, Renita. So we already know that Pfizer applied for federal emergency use authorization from the FDA, and the FDA has this outside group of advisors meeting next week to look at Pfizer's internal clinical trial data. If that group of advisors approves Pfizer's vaccine, it'll start rolling out immediately. And at the same time, we have Moderna, right? They plan on filing for emergency use authorization today. And as a reminder, their vaccine is also really hopeful. It's 94% effective at preventing the virus entirely and 100% effective at preventing any symptoms if you are infected. So we have these incredible vaccines on the horizon here. The FDA is likely to review Moderna's request on the 17th, which is about 1 week after they'll review Pfizer's data. And if the FDA approves the authorization requests, these vaccines are going to be available immediately. They'll be sent to the federal government for distribution, and they'll be doled out across the country.
So who will get the vaccines first, and what will that rollout process look like?
Right, again, the big question, right? We want to know who's going to get these shots first. Renita, you and I are definitely not going to be at the top of that list. The first 40 million doses are likely to be available before the end of the year, and that's really just enough to get to these two key groups that really need the vaccine, right? It's healthcare workers who are surrounded by the virus all the time while treating it, and the next group of people that can also get that first round of vaccines will likely be those who are at the highest risk and people who are living in long-term care facilities like nursing homes, for example. So that's the first group that's likely to get that first round of 40 million doses, which will impact about 20 million people. Next will be those who are at the highest risk as essential workers, right? So people like firefighters or teachers who have to go into work to keep the country going, and particularly those with pre-existing conditions in those groups. And then it'll expand to about 100 million people who just simply have pre-existing conditions in this country.
Okay.
And then people who are younger and don't have those conditions are likely to be the last to receive any type of vaccine.
Okay. So when it comes to this surge in cases, how could local officials respond to it? And is there another lockdown potentially on the way?
Right. So as we've seen throughout the pandemic, the local response is really what determines how a lockdown is going to be doled out. We've seen that in Los Angeles and Chicago, they've introduced sweeping stay-at-home orders that went into effect today. Here in the Northeast, governors of several states met over the weekend to talk about how private gatherings are really causing these spikes, particularly in states like New York, and governors are really trying to figure out how to curb people from having these smaller indoor gatherings without instituting another lockdown. But we're really hearing from public health experts that a lockdown is not the only way to move forward from this surge. Dr. Fauci, for example, said in several interviews over the weekend that he thinks if we adhere to the public health measures that we've really set on repeat throughout this pandemic, social distancing, wearing masks, and just staying home as much as you can, he says a nationwide lockdown just won't be necessary if we adhere to those measures, but that a surge in cases, which we know, Renita, is really expected following holiday travel, could change all of that.
Well, Madison, thank you so much for that report. We'll make sure to get another update from you later this week.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.